Vaccinations. I'm going to be your presenter today. My name is Lindsay Patterson. I'm a Community Health Promotion Specialist. So if you are joining me today, the community expectations would be to be present, be engaged, take care of yourself, ask questions, and have fun. What we will learn today: understanding what vaccines are, identify how vaccines are used today and why, discuss the vaccine schedule, share our points of view to learn from each other to make the best decisions for our families. So first question, what have you heard about vaccines and immunizations? What are vaccines? They are a safe and effective way to protect your body against harmful diseases. It trains your immune system to create antibodies to help protect you from diseases. What's in vaccines? There are antigens, which are killed or weakened forms of a virus or bacteria that you are aiming to protect against. This trains our body to recognize the disease and protect from it in the future. Adjuvants boost our immune response, which enables the vaccine to work better and more efficiently. Preservatives ensures that the vaccine stays effective over time. Stabilizers, these protect the vaccine before it is administered to our bodies while in transport or in storage. How do I know vaccines are safe? The U.S. has the safest vaccine supply. Most common side effects of vaccines are very mild: fussiness, soreness at injection site, low-grade fever. They do not cause you to get the disease they protect from. The most commonly used vaccines have been around for decades and are received safely by millions of people. The first vaccine was created in 1796 to prevent smallpox. Vaccines only contain a killed or weakened form of viruses or bacteria that help to build up antibodies in your immune system. There's a 3-phase testing process. So vaccines must go through extensive testing before being allowed to be introduced to the public. Even after being introduced, they have to continuously be monitored. They are approved by the Food and Drug Administration and then must undergo a 4th testing phase. So that was a little bit about the approval process. Also, there's something called VAERS, which is spelled VAERS, and it is a national warning system to detect possible safety problems in vaccines after licensure. Oftentimes, individuals think that because something is reported to VAERS, that the vaccine is what caused it. However, VAERS is a passive reporting system, meaning it relies on individuals to send in reports of their experiences to CDC and FDA. VAERS is not designed to determine if a vaccine caused a health problem, but it is useful in detecting unusual or unexpected patterns of adverse event reporting that might indicate a possible safety problem with a vaccine. So basically what this means is that a lot of times, people get sick for various reasons throughout the year, and sometimes that can happen right after someone receives a vaccine, so it doesn't necessarily mean that the vaccine caused it. However, this system can detect if there's a lot of common occurrences, which would be outside of what you would consider to be typical, and they can kind of spot early on some of those issues that might be occurring. What vaccines protect us from? Cervical cancer, COVID-19, flu, measles, hepatitis B, mumps, hepatitis A, rotavirus, whooping cough, chickenpox, polio, rabies, tetanus, pneumonia, meningitis, diphtheria, rubella, and more. Now we're going to talk a little bit about herd immunity. So what is herd immunity? When a large part of the population has immunity against a disease or virus that allows for some people who are unable to get vaccinated to stay protected from the disease or virus. In most cases, at least 80 to 95% of the population would need to be immunized to achieve herd immunity, but it depends on the disease. There can be issues with herd immunity, including reinfection, Herd immunity can be hard to achieve with viruses that spread and mutate quickly. And natural immunity does not work as well as vaccinations to create herd immunity because everyone would have to develop the illness once to become immune. And developing an illness can have health risks, sometimes serious, and you may not know if you've had the illness or if you're immune to it. Benefits of vaccines. Vaccines can save your life, they are safe and effective. Vaccines can protect others that you care about, save you time and money, and protect future generations. When is the earliest a child can receive a vaccine? The earliest is at birth, but depending on the vaccine, depends on when you can receive your first dose. So for some vaccines, your first dose is at 2 months, others it's at 6 months, and so on. Babies and vaccinations. Strengthen immune system. Babies' immune systems are still developing, and vaccines help to protect them. Protects from 15 different serious diseases by age 2. Babies are born with an immune system but can still get very sick and are not protected from everything. And it can also promote safe sleep. So regular immunizations are a safe sleep best practice. By getting baby the right vaccinations, you can help reduce their risk of SIDS, sudden infant death syndrome, by 50%. True or false? I can get vaccinated while pregnant. So certain vaccines are safe and recommended. Vaccines develop antibodies in a birthing parent which can cross the placenta and help protect their baby. Recommended vaccines while pregnant. Flu vaccine. Pregnant individuals who get the flu shot help protect baby from flu illnesses for the first several months after birth when they are too young to get vaccinated. Also recommended is Tdap vaccine between 27 to 36 weeks, ideally. Protects you and baby from whooping cough or pertussis. COVID-19. Much like people who are not pregnant, when people who are pregnant receive an mRNA COVID-19 vaccine, their bodies build antibodies against COVID-19. Antibodies made after pregnant people receive an mRNA COVID-19 vaccine have been found in their baby's umbilical cord blood. This means COVID-19 vaccination during pregnancy can help protect babies against COVID-19 by passing antibodies from the mother to her baby. So vaccines are safe to receive in breastfeeding. However, the only vaccine that should be avoided during breastfeeding is for yellow fever, unless the breastfeeding individual must travel to an area of risk. Where can I get vaccinated? You can talk with your pediatrician or family doctor. You can get vaccinated at the Barry-Eaton District Health Department, their immunization clinic. If you are pregnant, talk with your OB about a vaccination plan during and after delivery. Questions to talk to your doctor about. When should I get vaccinated? Do I have any special health concerns that I should consider before getting vaccinated? What vaccines can I get at this appointment? And where can I learn more about vaccines? You can learn more about vaccines at the Barry-Eaton District Health Department in the immunization clinic, from your doctor or pediatrician, from Children's Hospital of Philadelphia Vaccine Education Center, Food and Drug Administration, Centers for Disease Control and Prevention, World Health Organization, iVaccinate, and probably other resources as well. So the Barry-Eaton District Health Department Immunization Clinic, that's located at our health department at 1033 Healthcare Drive, Charlotte. You can call this number to schedule an appointment, or you can visit this website for more information. And that is just about the end of our presentation. We just have a couple more slides. We do want to let you know that we do have a Barry-Eaton Baby Cafe. We have 2 locations, one in Charlotte at Alive from 10 to 12 on Fridays, and another in Hastings from 10 to 12 every Tuesday. This is a great resource for anyone who is breastfeeding or thinking about breastfeeding. We have a IBCLC, that's certified, in helping with things such as adjusting your latch or suggestions on how to increase your milk supply and things like that. You can visit our Facebook page, Barry-Eaton Baby Cafe, to learn more. There's also a Region 7 Perinatal Quality Collaborative. So if you're interested in learning more about that, feel free to email me. Otherwise, thank you so much for listening to this presentation, and we will make sure to get you your packing plan. Here's our resources. Thanks.